Hello dear students, how are you? Hope you're enjoying the online lectures and getting some benefit at least. Let's study a very important topic today. Again, important from your examination point of view, and the topic is bronchopulmonary segments. Before going to the main topic, let's revise once again the divisions of the bronchial tree. You know the trachea? And trachea divides at the level of T4, that is fourth thoracic vertebra, into two primary principal bronchi, right and left. That is one for each lung. Now the features for the right principal bronchus are that it is shorter, wider, and it is more in line with the trachea. It is about 2.5 centimeters long. Since it is shorter and wider and more in line with trachea, so infections are more common in right principal bronchus. What about the left principal bronchus? It is comparatively longer, about 5 centimeters long. It is narrower and it is oblique, more oblique with the trachea. So these are the features of the right and left principal bronchus. Now if you see the division of the bronchial tree, there is a principal bronchus or primary bronchus which subdivides into secondary, which subdivides into tertiary, also known as segmental bronchi. And these are the bronchi for the bronchopulmonary segments. One for each bronchopulmonary segment. Here we can see the two lungs, the right lung and the left lung. And you can see the trachea, which is dividing into right and left main bronchus or the principal bronchus or the primary bronchus. And you can see the subdivisions. They divide, redivide and redivide. The dotted red line shows the hilum. Yes. Here is one more slide showing you the trachea and its two main divisions, right and left principal bronchus, okay, which divide and subdivide for the upper lobe, for the middle lobe and for the lower lobe. Likewise, it is for the upper lobe. For the left side we are talking about upper lobe, since we don't have the middle lobe. Here is for the lingula and then is the for the lower lobe. Now the features of the bronchial tree is the presence of cartilage. Cartilage initially is present in the shape of bars. They are U-shaped bars which are found, and gradually they are replaced by the irregular plates. It means the cartilage decreases, and finally what happens? The smallest bronchi which divides and give rise to bronchioles. The bronchi do not have cartilage in their walls. The bronchioles do not have cartilage in their walls. See this division? The respiratory system is divided into a conducting part and a respiratory part. From the trachea, the left main primary bronchus, cartilage is present. Now it's becoming irregular, and finally what happens? When it reaches the bronchioles, the cartilage is absent. Here is the, finally we have the alveolar sac that forms the respiratory unit. So the bronchioles divide and then redivide, and finally they give rise to the terminal bronchioles. These terminal bronchioles show outpouchings, delicate outpouchings from their walls, and this is responsible for gaseous exchange. In the walls of these outpouchings, what happens? Gaseous exchange. That's why the name is respiratory bronchiole. So you can see the alveolar ducts, the alveoli, the cartilage is absent, the smooth muscles are there, the elastic fibers are there. So these are the respiratory bronchiole or the respiratory unit, the alveoli. Now we come to our topic, that is bronchopulmonary segments. What are these segments? What's the definition? The definition is the bronchopulmonary segment is defined as a structural and functional unit of the lung parenchyma which is ventilated or aerated by a segmental or tertiary bronchus. Okay. The bronchopulmonary segment is what? It is a functional unit. It is a structural unit of lung parenchyma which is aerated by, which is ventilated by this segmental or tertiary bronchus. What are the features of bronchopulmonary segments? It is a subdivision of a lung lobe. Lung lobes we already know. For the right lung, 3 lobes. For the left lung, 2 lobes. And the subdivisions of the lung lobes is the bronchopulmonary segments. The shape is pyramid. It is a pyramid shaped and its apex is towards the lung root. It is surrounded by the connective tissue that is continuous with the visceral pleura. When it enters the bronchopulmonary segment, each segmental bronchus then divides repeatedly. Okay. Don't worry, we can just see the slides, the diagrams. It will be easy for you to understand. Now here are the 2 lungs. What is this? Trachea, dividing into right and left main bronchi. Okay. And can you see the divisions? These are the tertiary bronchus, tertiary, and they are going to supply the bronchopulmonary segments. This bronchopulmonary segment is accompanied by a pulmonary artery, but the veins are not a part of this segment. In fact, these pulmonary veins are in loose connective tissue and they are present in intersegmental planes. They are present in intersegmental planes. And each segment has its own lymphatic vessels and autonomic nerve supply. This you can see very easily by bronchography, the radiology. And since it is a structural unit, we are emphasizing on this part, in this point. It is a structural unit. So if there is a disease in a segment, that particular segment can be removed surgically. This is really very important point. So we talked about the intersegmental planes. This is a bronchopulmonary segment, which is, what do we have in this segment? First of all, let's see the planes, the intersegmental planes. These are the pulmonary venules. And what are the constituents? Is the pulmonary arteriole, the bronchiole, and the bronchial artery are there in the bronchopulmonary segment, but not the pulmonary venules. These are present in the intersegmental planes. I hope this is clear to you. Now let's see what are the various bronchopulmonary segments for both the lungs. For the right lung, for the upper lobe, these are apical, posterior, anterior. For the middle lobe, lateral and medial. For the lower lobe, superior, medial basal, anterior basal, lateral basal and posterior basal. Likewise, for the left lung, for the upper lobe, for that, apical, posterior, anterior, same as that for the upper lobe of the right lung. Okay. 2 additions are superior lingular, inferior lingular. For the lower lobe, again the same. Superior, medial basal, anterior basal, lateral basal and posterior basal. This slide is showing you the bronchopulmonary segments on the lateral aspect for both the lungs. Right lung first. So the various segments are: for the upper lobe is the apical, anterior, posterior. For the middle lobe, medial and lateral. For the lower lobe, superior, medial basal not shown, anterior basal, lateral basal and posterior basal not shown. Okay. The bronchopulmonary segments which you can see from the lateral aspect of the for the left lung, let's revise for that. For the upper division is the apical, posterior, anterior. Then for the lower division is the superior lingular, inferior lingular. For the lower division or for the lower lobe is, yes, superior, medial basal not shown. Then is the anterior basal, lateral basal and posterior basal not shown here. We can see in the other slide, don't worry. So can you just make out the arrangement of various segments accordingly on the various lobes? Yes? No worries, we can have another segment also, another slide also. So this is the right lung, the costal aspect and the medial aspect. Yes, we can revise once again the various segments. For the right upper lobe, apical, anterior, posterior. For the middle lobe, lateral and medial. For the lower lobe are the superior, medial basal not shown on the costal aspect. You can see on the medial side, the medial basal. Then is the anterior basal, anterior basal. Here comes the lateral basal. Here is the posterior basal, more seen on the medial surface. So we have seen the various segments on the costal aspect as well as on the medial aspect. This is for the right lung. Likewise, we also have for the left lung, upper lobe, apical, posterior, anterior. Yes, you can see this cardiac notch. So this is the anterior end. So this is the anterior segment. Then superior lingular, inferior lingular. For the lower lobe is the superior, then is the medial basal, which would be seen on the medial aspect. Then is the anterior basal, lateral basal and the posterior basal, which is more seen on the medial surface. Okay, so these are the various segments on the costal aspect as well as on the medial aspect or medial surface for the left lung. So these are the bronchopulmonary segments for both the lungs, right as well as left. Then we come to the applied aspect. If you revise the definition was that these are the surgical unit. These are the surgical unit, in an independent unit. So they are used in surgical resection planning whenever there is required. In which conditions? I'll just let you know. So these segments, since they are independent units, so they are used in surgical resection planning and airway disease quantification. Means airway diseases can be quantified depending upon the how much segments are involved. Then apical segment of lower lobe is the most dependent bronchopulmonary segment in the supine position. So foreign bodies lodge here commonly. Then there is a condition known as Mendelssohn Syndrome, that is also known as chemical pneumonitis or respiration pneumonitis, that is caused by aspiration during anesthesia, especially during pregnancy. And the contents, the aspirated contents are, they can be gastric juice, blood or bile, and they are in the superior or the apical segment of the lower lobe. Then there is a condition known as bronchic stasis. It is a condition in which the bronchi and the bronchioles are dilated. These segments, they limit the spread of some diseases within the lungs. Okay, so infections do not readily cross the connective tissue partitions between them. The connective tissue partitions, they prevent the spread of diseases. These segmental bronchi of the basal segments of lower lobe, they are prone to infections. They are filled with pus, and to drain them, postural drainage is done. Postural drainage is done. Then in conditions like bronchogenic carcinoma, this requires surgical treatment. It can be a segmental resection or lobectomy, removal of the lobe itself, or pulmonectomy. You can see the slide. This is the area where there is cancer. So the lung tissue is removed as such because of the bronchopulmonary segments knowledge we have. There can be a wedge resection, or there can be segmental resection, or can be a lobectomy, depending upon the situation. Now this finally, I wanted to share this X-ray. This is a special X-ray in which contrast media is used to see the bronchial tree. This is known as bronchogram. Okay. Now surgery is planned to remove this segment, bronchopulmonary segment. How do we define the bronchopulmonary segment? Or in other words, if I ask you, what are the boundaries of bronchopulmonary segments? Remember, we talked about, yes, can you come up with the answer? The intersegmental something, the intersegmental planes were there with the segmental venules. These form the boundaries. Okay. So the knowledge of bronchopulmonary segments is really very important for planning such surgeries. I hope the lecture is clear to you, and thanks for your patience. Thank you. Have a nice day.